So the question then becomes, how do you plan? What are the planning options? What is your next step? And so we now turn to the solutions. First, to recognize that our system, the way that we have it, is quite fragmented. We talked about health, housing, financial, and legal being the 4 different things that we must pay attention to. Not only do we have to pay attention to them, but we also must make sure that whoever is helping us in these 4 buckets, they must recognize that protecting assets, avoiding institutional care, and not becoming a burden on others is the goal that we have for this particular client. If we can agree on all of that, then the next thing becomes trying to get all of these people to work together. And here's how that looks to me. If you're looking at the health issue, and all of these people must be also focused on you, not only working together, but working together on this goal. So here's how this looks for me. On the health bucket, the first thing that I would say is, who is on your medical team? And if I look at your medical team, you probably are seeing a doctor you've been seeing for about 10, 15, 20 years. Nothing wrong with that. If you're happy with the doctor, stay with them. But if you're shopping for a doctor, you're not happy with your doctor, I would say you need to become familiar with someone called a geriatric care physician. Well, who's a geriatric care physician? Much like an elder law attorney. You know, an estate planning attorney and an elder law attorney, the difference between these 2 groups is we take a look at exactly the same information. Who are you? Who are your children? What are your assets? What's your income? But we come up with very different recommendations. Why? As an elder law attorney, I'm looking at 20 years out what's going to happen to you, 30 years out what's going to happen. And not only do I need to worry about estate taxes and probate, but I also need to worry about uncovered medical costs and making sure that if Safe Harbor Trust is not part of your estate, and for some of you it may not be, then how are we going to make sure your kids understand how to use the money to keep you out of a nursing home without you becoming a burden on them? That's the distinction. Same way a geriatric care physician will take a look at your issues and say, what do I need to worry about 10, 15, 20 years down the street? They will be more focused on preventing illnesses than just curing illnesses. So, and the funny thing is this, if you have a Medicare plan and you have a supplement policy, you go to the website of whoever that insurance company is and you look for the list and you put in the specialty geriatric medicine, out will pop about at least a dozen names of geriatric care physicians you could be accessing. So that's the first thing that I do, is I want to understand what your family history is. What is your personal health history? What is the likelihood that you will be facing uncovered medical costs down the street? You know, if your family history has any dementia issues, your own personal health history, you've got cholesterol, you've got diabetes, you've got some personal issues that are red flags to us, then we can start looking and saying we need to be focused on this issue a little bit. We focus on the medical team, make sure that we get you to prevent illnesses, not treat illnesses. And that is getting the right people. I think, you know, at the end of the day, eating right, exercising, and having the right medical people on your team is all you can do, because nothing you can do about a stroke. There's nothing that you can do about getting Alzheimer's. Someone's going to get it, they're going to get it. The question is, how are we going to deal with it?